Well, joining us now is Dr. Muhammad Sulaiman, the president of NARD, to explain the concerns, the implications for the health sector, and what may come next. Good morning. Thank you for coming on today.
Good morning. Thank you for having me.
Well, reading your communique was heartbreaking to a lot of people. I mean, they're already between the rock and a hard place, and then seeing that, it just appears as though all hopes appear to have been gone for a lot of people. Now, yes, you did meet, but just tell us, what is the current situation now? Has there been no communication whatsoever?
No. We've been following up on all the issues that we agreed in the Memorandum of Understanding signed on 27th November last year. You have to understand that these issues have been there for a while. These issues are not new. These issues actually affect or point at the heart of healthcare service delivery. Take, for instance, the issue of the professional allowances table that the federal government released a new circular on. This corrected an injustice that lasted 7 years. So what you have in Nigeria is that whenever basic salary is affected, maybe by a minimum wage change, we have an existing agreement with the federal government that it should translate and also affect allowances. But since 2019, all the minimum wage adjustments that affected basic salaries never affected any of the allowances. And at the end of the day, there were a series of agitations that eventually led to our strike last year. And then the federal government released the professional allowance table, and we agreed on implementation. It's captured in the circular release. That one, instead of the 7 years arrears, we're only going to get 18 months. We accepted that. And then implementation will start from this month, this January. Unfortunately, after we signed and agreed, these are budgeting things. For instance, Ministry of Health will tell you that the entire new allowances table or the corrected professional allowance table will cost the federal government, when you combine all health workers in the federal government, about 90 billion per annum, which means there has to be a budgeting process. As I'm talking to you now, there's a budget before the National Assembly for consideration. That has not been captured in the budget. In fact, payment of this correction, because you were earning 45 to 60% of your salary, of your allowances before, now it has been corrected. This January, it is yet to be captured in the salary.
Did they give you any reason for that?
No. There's no reason. I mean, literally, everybody packed their bags and went for the holidays. If you look at the issue with our unjustly terminated 5 resident doctors from FTH Lokoja, what are the issues? These are union leaders that protested terrible working conditions. One query led to the other, one committee led to the other, and they were unjustly terminated. And we sat down, complained to federal government, engaged federal government. In fact, there's a petition from that community to the National Assembly. And National Assembly made a pronouncement through the House Committee on Tertiary Health Institutions and recommended the reinstatement of these guys back to Lokoja. The Ministry of Health did their own investigations, set up their own committee, and the committee during the strike last year recommended that they be reinstated back to Lokoja. Not only did they recommend they be reinstated back to Lokoja, they also recommended that their back pays be given back to them, pay for the time that they were unjustly taken away from work. What did the Ministry of Health do? They wrote us a letter advising us to tell those our colleagues to apply for work in other hospitals in Nigeria, not Lokoja. What is the danger here? I'm a union leader. So today, if I'm queried in my hospital as a union leader for these agitations that we're currently embarking on, and then for one reason or the other I lose my job, does it mean if in the future my association agitated on my behalf as a union leader that was victimized, am I going back to another hospital? Won't I go back to my own family, my wife, my kids, and all of that? That is what our colleagues in Lokoja are facing. If, for instance, you look at the issue of the specialist allowance, the Ministry of Health wrote the Office of the Head of Service and said, we want to reintroduce this to resident doctors. We think it will help stem the tide of JAPA as an incentive to these guys. And the Office of the Head of Service looked at it and said, okay, fine, go ahead. In fact, the Head of Service went a step further to write the Salaries and Wages Commission, look at the administrative processes and implement this in line with your mandate. We're only hearing that, oh no, you're not specialist, so we will not give you the specialist. Why then in the first place were you asking for it to be reintroduced when we have even agreed that it will be implemented? Then you are taking a U-turn, a 180 complete from what was signed in that MOU.
What is making the U-turn? You know, some of the things that you have stated is making me want to pull out my hair, because it does appear that there are good people who are saying, you know, we should make this agreement. We should reach this. These are things that are good for our doctors. Yes. These are things that, and then somewhere along the line, you know, other people think they have other ideas, and then they stall the process. So, for instance, the reinstatement of the doctors in Lokoja, you have said that the National Assembly agreed that these people were unjustly dismissed. The Ministry of Health itself set up a committee. It agreed that these people were unjustly dismissed. Who are the people then who are now saying, no, tell them to seek employment in other federal teaching hospitals? That is on the one hand. On the other hand, you even said the head of service agreed that it was okay for you people to have a special allowance or something to that effect. And she not only stopped, she didn't just stop at the verbal agreement, she wrote the Wages Commission, Salaries and Wages Commission, to effect that. However, again, it was stalled. Somebody somewhere thought, no, these guys are not specialists. Who are these people who are somewhere in the middle, just stalling whatever process seems to have started?
This is very key to the conversation. Whoever we're talking about is the Federal Ministry of Health and Social Welfare.
That's not a person.
There's a Department of Hospital Services that looks at the issues of every hospital that comes to the Ministry of Health. There's a Department for Human Resource Management that looks at personnel problems that come to the Ministry of Health. For instance, the Lokoja issue, you can square it down to the Department of Human Resource. For instance, the issue of the specialist allowance, you can square it down to the Office of the Department of Hospital Services. There are people, there are directors there. I mean, take for instance, last year, January, February, the Ministry of Health brought out waivers for employment of health workers and doctors. And in those waivers, it now captured the entry level for doctors from COMMES 3, instead of COMMES 3 to COMMES 2. That is a grade level lower. Not only is it a grade level lower, it is 120 to 150,000 naira lower. And we challenged it. What the Ministry of Health said, and these are conversations with the directors and the permanent secretary and the ministers there. They told us these waivers didn't emanate from us. They emanated from the office of the head of service. And when we engaged the head of service made it categorical. We do no longer give or approve waivers for Ministry of Health. It is domiciled within the ministry. The head of service went a step further and clarified what the entry level for doctors is as COMMES 3. Now, that letter has been transmitted to the Ministry of Health, officially addressed to the coordinating minister. What is the Ministry of Health supposed to do based on our agreement is to transmit the contents of that letter to chief executives who had already issued appointment letters to our doctors on COMMES 2. That has not been done. The Department of Hospital Services should take that letter, the contents of that letter from the Office of the Head of Service, and write chief executives, guys, see, this is the entry level for doctors. For now, continue at this level. They've not done that. FMPH Barnawa has given out appointment letters at COMMES 2. FTH Ido Ekiti are looking at doing that too. National Air Care Center Kaduna looked at doing that. ATBTH Bauchi looked at doing that, but somehow saw the contents of that letter and held itself back. And then more centers will do that. The danger is that IPPIS will come capturing these new employees later this month. And they will come and capture them at COMMES 2. What we are now saying is that since we agreed in that MOU, Ministry of Health, communicate these chief executives, communicate with IPPIS through a letter. It's just a letter that this is what the head of service has determined. But that is not being done. And we are complaining, and then the complaints are landing on deaf ears. And we're being told we're being unreasonable about some of these things. These are just letters that we will write. But they will tell you in the Ministry of Health that there's nothing like letters to be written. I mean, if these decisions are not communicated to chief executives of hospitals and the accountant general who captures, or the IPPS who captures these people into the payroll, how then do you correct the problem? You know, so I can look at another issue and still give you the same explanation. For instance, the membership certificate. There are two colleges, the National Postgraduate Medical College and then the West African colleges, that of the surgeons and that of the physicians for West Africa. The National Postgraduate Medical College trains, you won't get a certification until you become a fellow. That is at the end of training, 4, 5, 6, 7 years later. Now, you pass a Part 1 exams, you don't get a certification. We're asking for that certification. Now, it will be spun in this way that how can a student come and tell his teacher what to be given? Where do you write an exams on earth today? You don't get a certification. For the West African College, they do give a certification after the membership exams. However, that certification in Ghana, in Sierra Leone, other West African countries, certifies you a specialist. A specialist. In Nigeria, is just additional qualification. And what is the reason? They said those African countries have a need for mid-cadre specialists. In Nigeria, we have no need for mid-cadre specialists. We have enough consultants. I mean, anyone that thinks we have enough consultants in Nigeria, I mean, something is wrong. somewhere. And these exams, it's not as if you go through separate curriculum, or you go through separate examiners, or you go through separate duration, or you even pay separate amount of money. No, everything is the same. It's the same exam, it's the same body, it's the same examiners. In other countries, it's recognized as a specialist. In Nigeria, it is not. Years back, they felt once we get these certificates, it will encourage JAPA. So we denied that specialist status. As I'm talking to you now...
Did they really say that? Or
yeah,
somebody
yes.
just...
In fact, in conversations, they throw it at our faces. Now from 15 till date, numbers of resident doctors in this country it came down from maybe 25,000 to right now just about 11,000. In 2024 alone, 4,700 doctors left the shores of this country. We'll see by the end of this month or February what is the statistics for the number of doctors. Doctors alone, not healthcare workers, because if it's the entire healthcare workforce, it's staggering. It's much more than that.
So people are still leaving.
People are still leaving. One, because of some of these professional stagnation problems. Two, because of remuneration issues. Because if you compare what you take home with doctors in Benin Republic, in Cameroon, don't even talk about Ghana, you know. Let's even talk about Cameroon and Benin Republic. I mean, the difference is quite clear. I'm not even talking about other European countries. And we're not saying pay us $1 million, $2 million, $3 million, like that. We know we're in Nigeria. We have our own economic realities. Then, the other most important issue, and permit me to talk a bit about it, is excess workload, burnout. You see a doctor, there's a Dr. Halima now in a hospital in Gombe that is on call every day of January, from 1st January to 31st January, in the internal medicine department of that particular hospital. What that means is that she's going to work from 1st of January till 31st. And then she's tired, she's exhausted, complicated cases will come. She's under-remunerated, she's underappreciated. She's told that agreements signed on her behalf cannot be implemented. And then she's expected to be diligent and at the top of her game throughout the duration of this January. It's not feasible.
Is that a general problem, or it has to do with each medical facility in terms of the burnout?
On the baseline, there is excess workload. But some hospitals, it is much more than others. For instance, in the monocenters, like the psychiatry hospital, like the orthopedics hospitals, it depends on the number of doctors they have. For instance, in my own department, I am a senior registrar in pulmonology. I am one of 2 senior registrars in pulmonology. I am a national president, and I'm here now defending the welfare of my members. The other one is taking call every day. My treasurer is the only senior registrar in plastic surgery. For about 6 months, he was taking call alone. If you look at the call duty roster for September and November and even October of Federal Teaching Hospital, Lokoja, you see a Dr. Yomi and a Dr. Victor Audu that are practically on call every day for those durations. Dr. Victor Audu resigned from that hospital because he asked for 10 days to go and be with his wife, who is to put to bed, and he was told because of shortage of manpower, he could not be given those 10 days. So he had to resign just so that he could be with his wife. And that is the hospital that terminated 5 doctors. They have only 32 resident doctors, over 80 consultants. Return those 5 to Lokoja, we're now speaking a whole lot of English.
There's a lot wrong, a lot that needs to be corrected. So it's, whichever way you turn, you don't even know where to go, where to start, what to address, how to go in, and it's a big challenge.
If you talk to the Federal Ministry of Health today, they will tell you, we want to do due process. We want to follow these things so that they are implemented properly. What issue have I raised on this table now that cannot be sorted out with one letter from the Federal Ministry of Health to a particular agency or agent of government?
Well, they said that the Minister of Health walked up until, is it 24th or 23rd of December before he then traveled. So one wonders if what was going on, why do these issues still linger? But then, is it true that about 21.3 billion of your arrears was released, and that about 60% of your members have gotten alert, and then they tend to release another 11.3 billion or thereabout?
What was released is actually even more than that. What was released cumulatively, if you look at a period of 3 months, is actually about 50 billion. That is the truth. But that didn't come to doctors. And I like being honest about it. Yeah. It didn't just come to doctors. It is arrears for the entire health sector. Now, in 2023...
What do you mean the entire health sector?
Everybody that you see in Federal Ministry of Health and hospitals across the entire federation. It is not just doctors.
So they had arrears?
They had arrears too.
They didn't go on strike?
No, everybody agitated. Nurses went on strike for about a week. Johesu threatened to go on strike. NMA even threatened our mother body to go on strike. Part of it was released. When we threatened to go on strike and we were on strike, the remaining balance was released. Where did these arrears come from? Federal government on its own looked at inflation and said 25-35% will be, your basic salaries will be adjusted by that amount. And then it was implemented. And then there was a date it was supposed to be implemented. 7 months were not captured. And if you calculate these 7 months, it is that amount that I'm talking about. Now, when they paid it, you know, because this is Nigeria, we play politics with everything, it was painted that 50 billion naira was given to doctors. And that is how it went.
So,
and it's so unfortunate.
I mean, because we're looking at time, in terms of getting the solution, because at the end of the day, if you go to any of these facilities, it's a sorry state. People are suffering. There are lots of people who are dying because no doctors are available to attend to people, and it's a really sad situation. In terms of getting a solution to all of this, because they say, some may think it's simple, but every now and then there's a strike or the other. So what would you recommend? Because it looks as if it goes beyond writing a letter, paying allowances. Do we need to retool, re-strategize, reorganize the sector such that you get persons who perhaps train in healthcare management to run some of these facilities on leave, as opposed to just getting a medical doctor to be a minister, to be the coordinating head, and things like that?
Well, I am a union leader. I look at the welfare of my members, and I look at the directive of the National Executive Council. When you talk about managing the Federal Ministry of Health, it is way above my pay grade. Whoever the president feels will manage Federal Ministry of Health appropriately for him. I mean, it is his decision.
No, I understand that.
For me, yeah, whoever is going to do that management must understand that whatever structure you erect, whatever infrastructure you implement, if you neglect the welfare of those healthcare workers, you're running into troubled waters.
Well,
for instance,
you may say it's above your pay grade, but whatever they do there affects you.
Yes,
you've been in that sector for decades, so it doesn't stop you from saying, look, I think this can change so that we can get better decisions or better resolutions. There's nothing wrong with that.
Well, I think perhaps people that have been trained and worked clearly in the Nigerian setting are better fit to understand the Nigerian problem. What did we do? We had 19 demands. If you look at the 9 demands that are there now, there are 12 or 13 items compressed into 9, because we don't want to stay away from work. The Ministry of Health brought out the statistics. In that statistics, they mentioned that in the second quarter of the previous year, 10 million people sought out healthcare services at the primary healthcare level. In the third quarter or the fourth quarter, the quarter after that, 40 million people did that, which means Nigerians are running to the hospitals with problems. Who sees these people? It is healthcare workers. It is somebody like me, which means the number has increased. All I'm saying is whoever is going to be at the helms of affairs should understand you can put all the CT scans and the MRIs, you can build all the cancer centers, but at the end of the day, if you neglect the health workforce, you begin to have problems.
That's a fundamental flaw in whatever they're putting out.
Yes.
All right, we need to wind up, but do you agree with that stats? I mean, I don't know if you saw it, where they said, I think about medical tourism had reduced to, is it 90-95%? You must have seen that.
Yes, I have seen it. I don't know what metric they use. I've not gone through the entire data. But I work in Katana, so I see patients actually from Niger Republic. I see patients from Chad. I see patients from neighboring countries to Nigeria. I don't know about the start of. I still see patients in my clinic that I give referrals that will leave the shores of this country, that will go and process their visa and go. Where that statistics came from, I mean, let me allow the Federal Ministry of Health to defend it. As far as I am concerned, 10 years ago, as a medical officer, I will probably see, in our unit, we'll probably see 1,000, 2,000 patients. Now, with less number of doctors, I know I see four times that number in a month.
It's 2026. We're just, what can we do? But
I hope they will impute all of these things in the 2026 budget so that January 12th will not happen.
Well, maybe when the minister returns, we'll have to put these questions across to them to see, why does this keep happening every now and then? Why? Why does it appear as though this is too big a challenge for them to sort out? But we have to thank you and hope that at the end of the day, we'll put the word out there and hope that all of this is sorted. But lots of people are really, really under the cusp as a result of all of this back and forth. Dr. Mohammed Salaman, President of NARD, thank you for your time.
Thank you for having me.